Hello, thanks for listening to the Total Knee Tips and Pearls podcast. This is Adam Rosen, your host. I'm a fellowship-trained orthopedic surgeon who specializes in joint replacement. In these episodes, I'm going to share with you a lot of my tips and tricks and review classic articles and current implant designs. Thanks for tuning in, and on with the show. Hello, welcome back. This is Adam Rosen, and you're listening to the Total Knee Tips and Pearls podcast. So in keeping with the theme, I'm going to move on to another classic article today, something just to make sure that you know and understand the history behind this and understand the classification. So we're going to talk today about heterotopic ossification by Brooker, and this was from the Journal of Bone and Joint Surgery, the American Journal, back in 1973. So JBJS, 1973. Brooker was the lead author, and it was titled Ectopic Ossification Following Total Hip Replacement. And this was performed at Johns Hopkins Hospital back in Baltimore. So what they did is they looked at 100 consecutive total hips. This was done by 3 of their full-time staff, and they had patients with a minimum of 6 months of follow-up. And there was a number of different techniques of what implants they use and different approaches and things. But the important aspect that the takeaway is understanding what the classification is and what they found. So what they found was that 21% of their patients that underwent total hip replacement had ectopic bone formation at 6 months. And they discussed this in 4 different types or classifications. And also what they found was that there was no difference in the Harris hip scores as far as these patients' outcome. They all showed improvement, even in the class 4 heterotopic ossification patients. Now, what they did was they looked at all of these patients with a supine AP X-ray, and they classified it in 4 types. So class 1 is that you see just individual islands of bone around the region of the hip. So that's class 1. Now, class 2 and class 3 are very similar but different as far as the spacing. So they describe it as bone spurs from the pelvis or from the proximal femur with at least 1 centimeter of space between them. That is class 2. Now, class 3 is, again, bone spurs coming from the pelvis or the proximal femur, but the space between those bone spurs now is less than 1 centimeter. And when they looked at class 4, this was this apparent bony ankylosis that they saw radiographically. So when they looked at their 100 patients and the 21%, 7 of those patients were class 1, 5 class 2, 7 class 3. And it was interesting because, they showed that everybody had increased improvements in their Harris hip scores. So that's what I was kind of curious about with, ankylosing changes. And both of those patients, they did note, had prior surgery. And although their Harris hip scores were low and lower than the other groups, they showed improvement. So it makes you think that back then, these were patients that must have had significant and severe disease, and so much so that even class 4 ossification was still an improvement from what they had prior to that operation. But it also leads into, their information and what they discussed with other articles. And, the takeaway and the thing that we all talk about too is prior surgery is one of those risk factors for developing heterotopic ossification. So again, Brooker, JBJS, 1973, heterotopic ossification classification, class 1, islands of bone. Class 2 are bone spurs from the pelvis and femur with a space greater than 1 centimeter. Class 3 are bone spurs from the pelvis and the femur, and the space between them is less than 1 centimeter. And class 4 is bony ankylosis on X-ray. So I hope you've enjoyed this. I'll throw some more classifications at you in the upcoming weeks. And until next time, stay safe. I'm Adam Rosen. You've been listening to the Total Knee Tips and Pearls podcast. You've been listening to the Total Knee Tips and Pearls podcast. Make sure that you're subscribed so you'll be notified of future episodes. And please take the time to leave a review. It helps other people like you find the show. Until next time, stay safe.